So bring your knee up, and then I'll have you resist me again. So you can do that same thing with the knee flexed. That's more specific for kind of a tendon injury. So if they have pain with that, now I'm thinking more tendons versus joint, right? Okay, then we're gonna go into a little bit more passive range of motion in the hip. So I'll do kind of internal rotation and external rotation. Now, if a patient is really tight and they're older, now I'm really thinking arthritis, right? Because if there's a bony restriction and I really can't move them very much, the most common thing that's causing that is arthritis. I've had multiple situations where a patient comes in thinking they're having a back issue. And so you always want to include a good hip exam when you're doing your back exam. Multiple situations where they think they have a back issue and it's actually hip arthritis.
You don't have to send all these to ortho. If you maybe take a little course or just get somebody to show you a couple times, this is an easy thing to keep in primary care, in my opinion, because it's one of the easiest injections to do. You can all right now take your one hand and go across to your other and feel the corner, if you will, of your shoulder. That corner you feel on the back, kind of diagonal of your shoulder, is the end of your acromion that's drawn on this patient right there. If you feel that corner of the acromion and you just dip underneath it, there's a soft spot, right? Underneath the acromion, that's where you put the injection, and you just angle it towards the diagonal, towards their body. So you feel the acromion, go under it in that soft spot, put it right in there, and just flood that area with steroids. That's the subacromial space right above their supraspinatus. The other beautiful thing about that is that it's not a very painful injection. I've probably done hundreds, if not thousands of these, and the amount of times that person actually thought that it hurt is minimal.